Perfect. So my prime advice is before you go into the station, not before you go into the station, before you start reading, we don't need the transcript. Yeah. Okay, before you do before you start reading the station, sorry, my computer's freaking out. Okay, before you start reading the station, my advice is to read the last line, because sometimes the script itself is quite lengthy and you're reading about the whole damn history about this patient and you're like, oh, okay, fine. So I'm assuming he's come in with like rectal bleeding, and then I may have to take a history about this, and right at the end it'll be like perform a PR exam. You're like, oh. So why I suggest for you guys to do this is because your brain will start prepping information in a way that you've already practiced. Okay, so you'll be thinking of the points that you have to make sure you get through once you enter the station. So that's my number one advice, is read the last line first, know what they're exactly asking you, because I was very confused on my A to E station of what they actually wanted until I got to the right at the end of the script, okay? And then it said, the nurse has called you in. It didn't exactly say, please perform an A to E assessment to on this patient. It said the nurse has called you in to assess the patient. And then I was like, okay, well, I hope this is A to E. So I'm just throwing that out there for you guys, that please read the last line of the script before you start reading. Some of them are very small, and even the ABG one was quite lengthy. And it was literally telling me about how this patient was in the shopping center and all of a sudden started sweating, and I was like, okay, where is this going? And it was basically panic attack, which kind of should have put me into the mindset of what I was actually even going to find on the ABG results when they asked me to interpret it. I passed it, thank God, even though another thing I should mention, they're quite lenient in marking. That doesn't mean you go in there and start forgetting things, okay, guys, because you're well prepared. You've gone through everything in major detail with Dr. Karim. So just practice, practice, practice. But when I went into my ABG station, I forgot to do the Allen's test. So one of the examiners, not the examiners, the actors, was like, the examiner was just sitting there quietly, not saying a word. But the actor basically, you know, said, you're forgetting something. And I was like, shit, Allen's test. Okay. And then by then I'd already said, okay, I would go and like take the sample on ice within 10 minutes and get, you know, although in real life, you never do it on ice, you just rush whenever. But please say that in the exam. And then I went back and I said, okay, ideally in the real situation, I'll do Allen's test before I'd puncture the patient's artery. And in my feedback, they didn't even mention that I forgot the Allen's test. In every single section of that station, I got 4 marks. So in my head, till the results day, I thought I had fully flopped that station. Now, that being said, like I said, please don't go in there thinking, oh, yeah, forget it. If I miss a couple of things. But like Dr. Karim always says, you're going into exam with a lot of knowledge, a lot of points that you have to remember. You're bound to forget some things. Hence why these examiners do understand that. Okay, so I've spoken to you about you get 1 minute to read the task. Start off with reading the last line so you know what's going on. And then there'll be another bell and you go in, okay? Now, another little moment that I had during my exam is I forgot the patient's name twice in 2 stations. Great. So I was either going to just not do anything about it and call them sir and ma'am the whole time. But there is a sheet of the script inside on a table, which nothing else is on that table. It's just a script. Okay. I didn't bother going in for the first time. And then I felt weird, you know, because sometimes I would say, oh, Mr. And I'll be like, oh, shit, I don't know his surname. And then I'll change it to sir. And it just basically ruined my flow a bit. So I on my second station, that when I did forget the name again, I went to go and check the patient's name on the script that was inside. Okay, so don't forget, don't worry about that, because sometimes when you're nervous, you even forget what the hell did I read outside. The script is inside. Okay, so that's pretty much 1 minute gone. The minute that you're reading, you've got 9 minutes remaining. Okay, please make sure that when you're practicing, or just in your mind in general, that you've got 2 minutes at the end that the examiner will stop you, okay, and start to ask you their relevant questions. And then, so you're practicing with how many? 9 minutes? No, how many? So 10, 9, 7 minutes, right? So when we practice with each other, we made sure we practice for 6 minutes, okay? So we're just going in and we're blurting everything out that's in our heads through our mouths into their ears, so they know that what we know what we're talking about. Now, from experience, when I did this, I had, either learnt the whole thing, memorized the whole thing, however you guys want to phrase that. I went in and just blurted everything out. One of my feedbacks for my PR examination said, please relax and ask the questions in a calming nature. Of course, I was trying to be calm, but I was also very nervous. And like I said, I wanted all the information to be out my mouth into their ears. I didn't get marked down for it. I got full marks in that station too. So just trying to show you that they are very lenient, but if you can help yourself with relaxing and just talking in a calming manner and not being a nut job like me, please try to. It's because we were practicing with 6 minutes, okay? Now, that being said, some of the examiners, for example, when I had my breast exam as a station, I basically did the palpitation of the lymph nodes in the neck right at the end. I'm sure you guys are too as well, when you've told the patient to sit up, right? So you go behind them out of convenience because they're now sitting up, they're gowned, they're not degowned, they're not sitting there naked, they're not uncomfortable. So you're palpating their neck. The examiner said to me, leave it. I was like, no, but I need to make sure I get this part done, and she was like, don't worry, leave it. And then I was like, but ideally, I would do this, and I would make sure I, palpate the central, the medial, the lateral, blah, 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 blah. And she's just sitting there thinking, I just told this girl to relax. She's still not relaxing. And then I think I had like 3 minutes left. And then she said, sit down, take a breather. I'm assuming that I was drenched in sweat. I was very anxious, nervous, whatever you want to call it, all in one go. And she said to me, just sit down, relax for a bit. And after like 30, 40 seconds, when she realized that I've caught my breath back, she said, okay, what does a triple assessment include? And I was like, oh, I know this. And I just like blurted that out as well. And then, yeah, so that was that. And I got full marks in that as well. I'm telling you this because some of the examiners will let you carry on. Some of the examiners, they've been doing this for years, okay? They know when someone knows everything. They'll stop you. Do not leave that station thinking, crap, I've flopped, or what did I do wrong? Because you're going to mess up the next station, okay? Because I didn't mess up the next station, but I think it did have an influence of how I started to think with the next station, because I was in freak mode. Now, any questions on that, anyone? Nope. Okay, that's good. So you'll get 2 breaks. So these are stations that you go and sit into, a room that you go sit into. Some people start with a break station, so don't freak out. I didn't, which I'm not really bothered about. My last station was a break station. And I was quite freaked out in my last station that was a break station because I was thinking about all the things that I may have got wrong. But yeah, use that break station to, there's a drink station there. They've got a fountain, a water fountain. Take a drink, relax yourself, sit down. Don't do what I did. I was pantsing up and down the room. So yeah, use the break stations are just relaxing, okay? You're not going to know what the next station is. Don't bother poking out because they're going to come in, and I didn't see it, but I heard someone being told to go in. I don't think they were disqualified or anything. Before I carry on, please, 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 please take your passport. Some people did show up with other forms of ID. There were tears, and people had to be refused to take the exam. So make sure you take your passport, take your stethoscope. And another thing is, when I went in, a lot of my stations didn't require a stethoscope, okay? So I put the stethoscope down and I put it in the corner. Now, that being said, when I went into my A to E station, I again put my stethoscope down. Now the sim man, well, it's not really a sim man, by the way, for the ATE thingy. You don't hear anything, you don't feel anything, you don't hear any noises. It's not a sim man at all. It's just a mannequin, okay, like a whole mannequin, a human body mannequin. Not a human body, but an imitation of a human. And then so I was in such a I was just in the zone of always taking my stethoscope off and putting it in the corner. I did the same thing to ATE. I had started the station because the examiner just blurted out that this is what the nurse has said. It was no one else in there in the ATE station. It was just me and the examiner. So there was no nurse, there was no one. So from the script that I read outside saying the nurses are quite concerned, and two of the nurses have called you in. So I was thinking maybe there's going to be a show inside, but there was no one there. It was basically me and the examiner. The examiner literally said to me what was on the script, and that's it. Didn't tell me any vitals. I had to ask that, of course. And I started my ATE assessment with my stethoscope at the other end of the room. So I'm telling the examiner, okay, well, I will place my stethoscope here. I just didn't want to waste time and go all at the other end of the room. That room is quite bigger than the other rooms, by the way. I was, just imaginary saying I'd put my stethoscope here. Am I hearing anything? Am I hearing anything? Am I hearing anything? They said no, 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 no. Whatever they said, I don't remember actually. Actually, no, it was fine. Yeah, nothing on auscultation. It was an opioid OD for mine. And then post-op patient opioid OD. And then so that was that. Just trying to throw that out there that please, maybe for your ATE, keep your stethoscope around you. I didn't get marked down for it. I had nothing on my feedback for it, but I thought I did ridiculously bad because what the hell was I even auscultating? And then at the end, I found out it was just a mannequin. It wasn't a sim man, because I was thinking, what if it was a sim man and I didn't hear anything? But anyway, that's that. Any questions so far? Nope. You can also write in the chat as well if you guys feel shy. Okay, no questions. All right, so that was that. Now, of course, it's in Manchester. Get there nice and oh, yep.
Sorry for cutting you off.
No, that's fine.
Yeah, so I'm Chidi, and I have a question. So you talked about the stethoscope. Does it matter what kind of stethoscope we have? Because somebody is asking in one of the group chats, like, must it have like a bell and diaphragm, or it doesn't matter?
Yeah, of course, like make sure the bell and the diaphragm is attached to your stethoscope. Please don't go there with the dangling nothing. Just a normal.
I mean, some stethoscopes do come with only the diaphragm. That's what I mean. Like they don't
okay, yeah, no, just any stethoscope, really. Even if you've got the most technical one, that's great as well. You're basically not even going to be using it, to be honest with you. I mean, except for in the clinical examinations when you're doing like cardiovascular and respiratory. Even then, I'll be completely honest with you, there's so many, because I'm still not very good at hearing things with my stethoscope. So when I assess patients, I always get someone else to come and hear what I'm hearing as well. But in the exam, there's going to be so many clues for them to guide you in the direction of what the diagnosis is. But yeah, to answer your question, any stethoscope at all, like any, it doesn't matter.
Okay, thank you.
Okay, no, sorry, I do tend to make funny jokes. I didn't mean to think that you were suggesting to just have something that doesn't have a bell and diaphragm. But yeah, so yeah, any stethoscope. But just Joanne, from my experience for the A to E, I would just suggest to keep it around your neck for that. You'll obviously know that you are performing an A to E. It won't say in the task you're about to perform an A to E. It will literally be like the nurses are concerned. They've asked you to come to see the patient or assess the patient. So automatically start to think, okay, this is an A to E. Okay, and yeah, so that's all that I was pointing out for that, is just make sure it's around your neck, because I don't know what the hell I was doing. And in my head, I was thinking maybe it is a sim man and I'm not hearing anything. But I was asking this examiner at the same time, so it was reassuring to me when the examiner said, no, you don't hear anything. And yeah, or dull on percussion or whatever she was saying. Make sure in the ATE I was given a news chart. And everybody that took the exam was given a news chart. Sorry, I know the way I'm explaining everything is all over the place, but whatever comes to mind and I feel like it's important, I'll tell you. I was given a news chart. I obviously knew what a news chart was prior to this, but I didn't practice in a way to make it more efficient, time efficient for myself, to be like, okay, this is news 3, news 4, news 5. Now, of course, being in practice for so long, I do know how to read the news chart very efficiently and very quickly. But because it was one of those news charts that they cross stuff out, so the blood pressure, the diastolic and the systolic was crossed, and you just got to know that the color scheme, okay? So just be familiar with that. I can go and Google it, what it looked like as well, and I can send that in the group. Because when I go to work, the news is normally just written down by the nurses. But even if it's not, you can quickly just check what's the respiratory rate, what's the heart rate, what's the blood pressure, what's the temperature, what am I missing? Heart rate, respiratory rate, oxygen saturations. You can quickly just check and then see what news they're at from there. But when you're looking at a chart with these crosses everywhere, with color coordinated stuff that nurses normally do in an exam, you're just like, okay. So that kind of put me off a little bit. But still, I was able to identify that the patient was newsing at 5. The examiner did ask me, I saw the news chart, I looked at it, and I just put it down, okay? Just thinking, all right, obviously there's something going on. I can see that this new person is newsing above 4. That's what I had in my mind, because I didn't go through everything, and I just put it down, okay? So I just basically looked at temperature. I didn't bother looking at blood pressure because the X's were confusing me, and I just put it down. And then she said, what's the news score? And I was like, so I picked it back up and I started calculating again, and then it was fine. But anyway, so I'm just throwing that out there, that be familiar with reading the news chart efficiently, quite know where your eyeballs have to focus on. So that was for that station. What else? Any other questions from you guys?
Sorry, can I just jump in there just to ask?
Yeah.
After we do the ATE assessment, just specifically for this station, do we also present your findings? But then it'll be findings that the examiner has told you as you've gone along?
Yeah, so what it is, when I was prepping for the exam with my colleagues, we had this whole protocol of this is how we're going to present the case. Now, in the exam with A to E, for example, you're presenting whilst you're doing the exam itself. So you're like, okay, so I see that the oxygen saturations are below certain point. I'm going to put a 15-liter non-breather mask on. So you're basically pointing out, you're speaking whilst you're doing all this. Please do not do it in your head, okay? Please, okay? Make sure that you're saying everything that you're thinking out. Because at the end, for especially in the A to E station, if something like a rash or, you know, or like a wound that's not healing is all the way into E, and you're rushing back to go back to A to make sure the airway's patent, to make sure the breathing's better, you're not going to have that much time to stand there and present your case to the examiner. So whilst you're going on, just talk out loud, okay, and tell them what management you're doing as well. Does that answer the question?
Yeah, no, that does. I guess I was also wondering, while we're talking through as we're going along, at the end, we'd also have to present a summary of our findings, I guess.
Yeah, so with the summary, it's not going to be like a summary. So it's not going to be like, okay, so this patient has come in with this, I've done this, I've done this, I've done this. It's basically the examiner asked me, what do you think is going on? And I said, after looking at the drug chart and seeing that they've been on morphine for quite a while, I think it's this, okay? So, and then what would you do after that? And that's it. So it's basically pointing out what's going on and then giving what you would do after that. Does that answer the question?
Yeah, that's perfect. Thank you.
Yeah, so you're not going to go there and be like, this patient came in with this. I performed an A to E. On A, I saw this. On B, I saw this, and then I did this, and then on C, I saw this. On, you know, so don't worry about being there, standing there in front of the examiner and remembering all those numbers that you've just gone through, like, oh, the blood pressure was this and the heart rate was this. None of that's going to happen. It's basically the examiner's going to be like, okay, that's fine. I kept going back to A until the examiner stopped me. I only had to do it twice. So obviously the first time around, and then I went up to E, and I already knew what it was, but I wanted to say it to the examiner, but then I said, okay, well, I'll go back to A and assess the airway again. Sir, Mr. whatever his name was, clearly I forget patients' names always. Can you hear me? And he was responding. And then the examiner said, yes, he's responding. And then the examiner said, okay, that's fine. You can stop now. And I was like, thank God. And then she said, what do you think is going on? And that's it.
Perfect. Thank you.
So,
right, so okay, go ahead.
You said in the end, the examiner asked you what you thought was going on.
Yeah.
Was that the time you also talked about your management, or you did that like as you went?
I basically said, this is what I think it is. It's opioid poisoning. After looking at the drug chart, and she said to me, and having these symptoms, and she said, what would you do? And then I gave her the management plan. That's it. And she said, nothing, not even a well done. So I was like, okay. But then I got 4 marks. Yeah.
Thank you.
Yeah. Someone else was going to ask a question.
So you mentioned that you checked the drug chart. So at what point in your A to E did you do that? Is that before the A or after the E?
I checked the drug chart at D.
All right.
So I could have checked it a little bit earlier. I believe that there's no set point for drug chart checks. Let me see. I've got all my notes here, but I checked it at D, yeah. So I think if I did check it earlier, it would have made my life a little bit easier. But then again, because you're so focused on, I'm going to do everything step by step. But that being said, I did have some time left. It wasn't like I was rushing through that station either. For every station, I had time left. So just that. But just throwing it out there, because some people, when we left the exam, were still so clueless of what it was. And it was the exact same task that I had got, like in my circle at least. And then we were discussing after, and they were like, it was sepsis, and those people didn't ask to check the drug chart.
All right.
So yeah, make sure you check the drug chart, because when we do A to E, we don't really put in drug chart, do we? But maybe just remember D for drug chart.
Okay.
Yeah. I'll try and find out where exactly I asked it, but yeah, I'm assuming it was D. Anything else, guys? Nope. Okay, so let me see what else I can kind of flag up to you guys. You're
Hi.
definitely Oh, yes. Hi.
Hi, sorry, this is Jude.
Hi, Jude.
So yeah, hi. So in your ATE assessment, at what point, sorry, so during your management, at what point do you say you would escalate it to the seniors, or you would seek the seniors' advice?
So in my situation, I went through the whole ATE by myself. Okay. At that time, you know, there wasn't anything that the patient was crashing or getting worse. So I kept going on in my own way, like from A, E, B, C, going back to A, then doing D, going back to A, and then doing E, right? I stated that I will get the seniors involved right at the end in my situation.
Right, okay.
Yeah,
So you
because it
said
wasn't like
that.
a situation that I was in, like for a BLS station, you know, where I would call for help earlier on. In this, it was a comfortable, it was an easygoing, not a stressful scenario. You know, I knew what was happening as well. Of course, if you don't know what's happening, I would suggest that you would mention that you will get a senior involved sooner than I did, of course. There's no set point to saying it. I believe that, you know, in real life, when I have gone through crash calls, we call the senior as soon as we get on the, you know, the stage. So we call them as soon as possible. Okay, so I don't think there's any harm with you saying it earlier. There's definitely no harm in saying it earlier. There may be some harm with saying it later, but at the end of the day, this is a checklist exam. So this is what you need to remember. Remember when I said that I forgot to do the Allen's test? I still got those marks because fair enough, she did tell me you're forgetting something, but because I said it, eventually I got the mark for it. Okay, so as long as you're checking everything, obviously I'm not saying have your assessment all over the place and start off with E or something, but it's that those little nitty-gritty details won't have a negative effect on your mark, if that makes sense. But yeah,
Right.
the sooner the better, if anything. But for me personally, I ended up saying it right at the end.
Right, okay. Thank you very much.
So
And
when she
then,
asked me the management, what would you do? I'd said obviously I'll give naloxone, and then I'll also inform my seniors about what happened and tell them what I've done and see if they would do anything different. Just out of stress, I just said
okay.
that. But yeah, that's it. So I said it right at the end.
All right, okay, that makes sense.
Yeah.
Oh.
Anything
Sorry,
else? Yeah.
second question, yeah. And at what point do you request for investigations as well? During your ATE assessment, is it right at the end?
So it depends, because you're going to be putting a large bore cannula in, right?
Yeah.
Okay, and what point do you put that in?
C.
Perfect, C. And then when you say that I will be putting a cannula in from one side to give IV fluids, and the other one I will tell the nurse to take out bloods, you state what bloods you want then. Don't
Right,
leave that to the end. Okay, just say it then. So I need my FBCs, using E's, my LFTs, my clotting, my group and save. Just say it all. Okay, just say it then.
Just
Don't leave
everything.
that to the end. Okay.
Right, okay. What about so say you're dealing with pneumothorax, anything respiratory, when would you request for ECG? I'm sorry, chest X-ray, sorry.
Chest
So chest
X-ray I would
X-ray
do
and
along with C as well. So just get them
along with
over. So
C,
when you
okay.
say, and then with the chest X-ray, make sure you do vocalize that you'd get a portable chest X-ray, because in this situation, you're not taking the guy to radio right now. Okay.
Yeah.
And there's no porter that's going to
portable,
come in like within 5 seconds. So I would initiate a portable chest X-ray to be available for this patient, and I'll let the nurses know that this is what I need. Also, there's going to be no one there, which kind of put my nerves to ease a bit, because if there were people there, I might be freaking out.
Yeah. Okay. All right.
Yeah.
Thank you very much.
No worries. So just get it out, you know, try not to leave anything end minute. Okay, so this is when I said to you guys, as you're going along, vocalize what you would do as well. Don't be like, oh, let me show off at the end and be like, all right, I'm going to do these bloods and these investigations and this is my management plan. Say it then and there, okay? Say it then and there. And you'll actually see that the examiners got this iPad, okay, and they're going like they're pointing. Okay, I clearly had too much time in some stations for me to realize that this is what's happening, but they're ticking something here, and then their hands going down, then ticking something there, and ticking something there. So they are following the checklist, and they know this checklist inside out because they've done it so many times, right? So they're checking. So their checklist is probably in an order that we're not following, but because we're getting everything out there, they're still checking it off. Do you understand? And the more you get checked off is the higher your score. So it's basically they've already made sure that this is the minimal score that the students need to get, you know, the examinees need to get to pass this station. So it doesn't matter. Some of them mess up on introduction and still pass the whole station.
Yeah.
You know? So yeah, okay. Any other questions, guys? No. Okay, so one other thing from my own exam is when I had a hernia repair for my perioperative. I was going great, thought I knew the whole flow. I sent you guys the flow. I was following that. I knew exactly what timings they need to come in, need to eat, stop eating, drinking, although there's not much to know with hernia. So I was thrilled that it was a hernia repair. And then the patient threw into me, so what's the mesh made out of? I think I've actually discussed this with a couple of you guys, and I still probably don't know. I know Rachel has informed me what it was in the past, but I still don't remember. So Rachel, you may want to jump in and let everyone know. But at that time, I just said poly something, and both of the examiner and the actor just laughed. And yeah, it was poly something. What is it, Rachel?
I think it's polypropylene. So
okay, polypropylene. There we go, guys. So remember that was something that I messed up on. It wasn't mentioned on my feedback. I didn't get marked down for it, but it was just something that traumatized me for weeks and weeks until I actually got the results. I should remember what it is, but I'll probably ask Rachel in future if that time ever comes again. But yeah, so I just said poly something, and so I'm just telling you this, guys, because the exam's pretty laid back. It's easy going. You guys have gone through literally everything that possibly can come up. Just keep practicing. Now, I'm going to talk about a little bit of how we actually practiced. So before the course started, I was on Telegram. I'm sure most of you guys are as well. And I basically just started messaging people, who's free, who's free. I need a dedicated study partner. I did this 2 months prior to the exam. So 1 month prior to the Plabcoach Academy, whatever you want to call it, course. That's weird for me to say, but yeah, I started asking people, could we practice? Now, everyone was in different towns really far away from me. I live in London, even I'm from East London, and people that are from bloody North London, sorry for saying bloody, we love you guys. I don't know if you guys love us back, but yeah, I'm just saying this if there are any North Londoners here. I didn't get to meet these people every day, you know, it's quite hard. And then the center itself is in Birmingham, so to us go there every day, it just wasn't possible. Okay, so I'm pretty sure some of you guys are in that situation. I know some of you guys are coming to practice every day. That's great, bravo, honestly, but I couldn't do that. Even though I'm married there, but I still was staying in London. Well, no, at the time I wasn't married then. So yeah, but yeah, okay, getting carried away a bit. But I was in London. So what we did Zoom sessions, we did MS Teams sessions every single day without a doubt. Now, some people were only available couple of times a week, but I was making sure that I had bookings with people. I shouldn't say bookings, but I had planned study times with people from 9 o'clock in the morning to 1 o'clock. in the afternoon. From 1 till 7, I was doing my own thing because I couldn't listen to anyone else. I'd do my head in. From 7 to 9, I would have a practice session again with a few people. There were actually people from Pakistan and India, Bangladesh. There were people from South Africa that I was studying with online every single day, okay? Like, do not use this as an excuse that you guys are not with each other. I literally had a pillow folded in, like, okay, this is a pillow. Okay, I literally put it like that, put some books at the end. So this is the head, this is the abdomen, these are the legs. Okay, I literally did that. I'll send you guys a picture. Well, I won't send it because Karim's gonna be like, what the hell are you sending in the group? But I literally was practicing on a pillow. Okay, now there were some weirdos out there that are very good friends of mine that actually bought very big teddy bears to practice on, but anyway, whatever. That's another, yeah, whatever, to each their own. But it just basically makes sure that it's second nature to you to know where you're placing the stethoscope, where you're palpating, where you're percussing, how you want the patient to sit, stand, you know, the position of the patient. It just becomes an easier flow of doing it. I know I didn't have anyone around then as well, so I couldn't even use, some people were using their baby sister, baby brother, giving them £5 a day for doing this. But some people, I didn't have anyone, but I was using a pillow. I'm only saying this because use each other, guys. Do not use the excuse that you guys are not in the same city or not close to each other, and you don't have access to the academy itself. You can do it all online as well. Okay, so, and I was doing this up until the exam, and we were practicing for 6 minutes every single station. So I would be the examinee, someone would be the examiner, and then someone else would be the patient. Okay, we would put all of only the people that are practicing, so myself, the examinee, the examiner, and then the patient would put their cameras on, and everyone else would just be in the background. Now everyone else would also act as an examiner, taking notes of things that we missed, what they would suggest for us to say before or after, in what manner, because sometimes English is not our first language, we stutter, we waste time with not knowing how to phrase things. So we were helping each other out how to phrase things as well. It was a very great time, to be honest with you, because I grew so close with these people until this day when I don't know things and I work in a completely different trust. I messaged you guys this as well. No one that I studied with is in UCH. No one is there at all. I still always message them and I'm like, guys, what would you do? Okay, we still have the same group of people that we had. We made it away from the Plabcoach group because we didn't want Dr. Karim to like see everything that we were doing, because he would probably, I don't know if he really would, or maybe he wouldn't even read it, but it was just like we wanted to do it on the side. So we made our own groups, and we still have those groups, and we ask each other questions all the time. Okay, so use this time, you're in this group, there's so many of you as well. It doesn't have to be the same group as well. You can just make sure individually you guys are booking your times with each other. Okay, so if someone says, oh no, Patrick, I made sure that I wanted to do, like, you're supposed to be studying with me, just be like, no, Hanifa, you can study with Jude, you can study with Lena. Everyone can just study with anyone. Okay, so don't think like you're going to be buddy in one little group. Okay, the more exposure you have to each other, the better, because one person can be saying something, the other person can be saying something else. Either or, you're going to be learning, and you want more feedback from more people in this. Okay, we basically use the script, how Dr. Karim has, we went through the videos like 500 times, not 500 times, but I probably did, but we had to go through them quite a bit, hence why when you've seen my notes, I've literally written every single word down, and it just helped me, just having a quick flow during the exam and not stuttering through it, even though I probably was sweating my beep off during the exam, but yeah, it is what it is. But I'm just trying to tell you what you guys need to do. You have all the resources. Use each other now, okay? Please, any of you guys that are sitting there trying to do this by yourself, you don't need to. You have each other. Some of you guys that are not in the time zone, accommodate for each other. One person get a little bit up a bit earlier. I'm sure all of you guys are here in the UK, but if not, don't worry. You know, like I said, I did practice with people that weren't in the same country as well. And I got great feedback, you know, great feedback for them. Like, and Jim, no, make sure you, like with this whole blood thing that I told you, like in my head, I was thinking, okay, well, I'm going to be a bit of a show off and, you know, give them my whole management plan and my investigations on what I did right at the end in a nice way. But then someone kindly did say to me, that no, say it as you go along, because that person had already taken the exam before and unfortunately they didn't make it, but they did when we practiced together, they did on that year, and that was one of the mistakes that they had made, to leave everything at the end. So yes, use each other, okay? Practice the drug charts, filling the drug charts in. For the prescribing station, are you guys still with me, or am I boring you guys? Just someone say yes.
We're with you.
Okay, cool. Great, thank you. 2 is better than none. No, I'm joking. I hope you guys are bloody listening to me. So with the prescribing station, there was no patient there. I was like, what the hell is going on in this exam? I went in thinking that I'm going to take a whole prescribing history. There was no one there. It was me, of course, the examiner, okay? He was sitting in the corner, didn't say a word, by the way. The task, a paper BNF, the big thick book, and an iPad with the BNF on it, okay? And the examiner was sitting at very close proximity to me, which, yeah, too much in my space, but it's fine. Maybe they just want to know if we're using the iPad for alternative reasons. But they were quite close. There was no one else. The sheet, I am pressing yes, right? The sheet that was given to me in the prescribing, the person that just came in late, don't worry, I've recorded it, so I'll send it, so don't worry, you'll be able to go over it again. Sorry, what was I saying? The prescribing sheet that was given to us, the prescription sheet, the name, date of birth, allergies, everything was already filled out. Okay, so I don't know if you guys know this or are aware of this. The last year was the same as well. Unfortunately, I won't be able to tell you about last year, but I can confirm with Karim if he knows about it. But it was filled out by itself. So in my head, we were bloody practicing for prescribing station, like, you know, because we only practiced for 6 minutes. So we were like, oh, okay. Of course, we got great at it. But when I went to the exam, very relaxed, okay? There's only a couple of things that will come up in the prescribing station, like you've already gone through. I can try to make a list of things that may come up as well. If that will benefit you guys, just drop a message into the group and I'll get onto that as well. I spent like all day yesterday organizing my notes, because I've got like quite a few one-to-one classes as well, so they bombard me with questions and I always have to be prepared. But that's the situation that happened with the prescribing. I had so much time in the prescribing station afterwards, and the examiner didn't ask me anything, absolutely nothing, and I just left the page there, you know, on my desk. I didn't even open the paper BNF because I knew what to do in the thing, in the electronic BNF on the iPad. And it was basically a macrolide and statin interaction, and I had to stop one. Make sure you know how you're crossing out the number of days, okay? So that with X's, or you can put a line through it. You obviously have to make sure you sign, signature, date. That was important, but everything else was filled. So hopefully that puts you at ease as well a little bit. Another thing that if you have any questions, please feel free to interrupt at any time.
Yeah.
Yep.
Sorry. So was it for all the questions that you got? No, for all the stations that you got questions asked after, or some you didn't get questions after you presented?
All of them I got asked. I don't think there was anything. So for ABG, I had an ABG to interpretate. So I literally spoke out loud saying, okay, well, the oxygen, because I always start with oxygen, you go to pH. So I spoke out loud throughout the whole thing. And then they said, why do you think this is happening? It was obviously a panic attack. And then that's it. I sat down for the rest of the time. For the breast mannequin, it was about what was the triple assessment would be, and what would you do? Would you do an ultrasound or fine needle? For the PR would be what was the additional tests that you would do? For the A to E, it would be like, what do you think it is and what's your management? So they all asked me questions afterwards. The only thing, no, they asked me. So yeah, the other thing that I want to tell you is the history taking. So the focused history taking, you're definitely going to get one medical and you're 100% going to get one psych one as well. Okay. So please don't think you're only just going to get one out of those two, the one station in the focus history. You're definitely going to have a psych one. The psych one was so straightforward, honestly, but the actor threw me off a little bit because she bloody started crying, and I was like, I didn't expect that, you know. And it was COVID time. Her husband had just recently lost his job. They was not having enough food to survive at home. I clearly was asking everything that I had learned in the psych history, but I realized that in real life, because I've done psych liaison as a placement as well, you have to have a flow with these patients. And if I were to go back, I would let the patient talk for a bit, because in the patient talking, you'll get most of your questions answered. Now, that being said, please don't let the patient talk and talk and talk for 5-10 minutes, because you don't have that much time in the exam. Make sure you do the risk assessment. Okay, that's very key. Make sure you do the key risk assessment questions in this, because it's a whole mark for this as well. And people did fail the station as well from not doing the risk assessment, because you have to make sure if they're a risk to themselves, to others, or from others. Okay, so those 3 questions are very important in this, regardless of what the situation, even if it's mild panic attacks to all the way to severe depression. Risk assessment is one criteria that you need to make sure that you get ticked off. Okay. So yeah, just make sure that you know that 2 stations will come up on focus history, or one will be medical, one will be psychiatric.
Right. Thank you.
And my one was moderate depression with, I said moderate depression with mild anxiety. I thought I'd just be a bit, and then my feedback was like, great job, 2 words, and that's it.
Okay. And were there any stations where, while you're presenting, you didn't finish before the examiner stopped you? For example, maybe your history, you're still going at it, and then the examiner.
So yeah, that's the thing. If you're going on and you're running out of time, the examiner will stop you, just so that they can give you an opportunity to answer their questions and pass the station. Okay. If you're going on and you're not making sure that this is why practice is so important with each other, guys, because practice with 6 minutes, we even, honestly, when I say we, it was me, the dork that went on Amazon, and I got this huge stopwatch, and whenever I would like practice with people, I'd put it like this, like in front of the screen, and I'll be like, all right, time's up, guys, and I'll just be like, all right, no more. Okay, you can't do anything else. That's it. That's all you have. You got 6 minutes. So that's why I'm saying time is very, very important. And if you don't practice with each other, if you're doing it in front of a mirror, you're doing it at home, you're not getting the full grasp of what the exam's going to be like. Okay, so please use each other and time, because time is very important. There have been situations that why do I keep saying patients? Students have run out of time, but in those situations, what's happened is the examiner will stop you. Okay, the examiner will stop you and ask you, okay, what do you think is going on? Okay, so what is your initial thoughts of what's happening right now? And by then, maybe if you haven't asked your important questions, you won't know what's going on, unfortunately. Okay, and then your management plan is clearly not going to be right as well. But if, just in case, if that does happen, throw out all the differentials that you know. Okay, so if you know that if it's chest pain, if you have a feeling, or if from the history you know that it's cardiac related causes, please throw out that I will check for if it's an ACS, what kind, do an ECG, send out troponin levels. If you're thinking, and then throw out, even if it's probably not going to be aortic dissection, just throw it out. This is only to put yourself on the safe side. But then again, I'm hoping that none of you guys are going to be in that situation, because use this time to practice with each other. But just in case, God forbid, if you are, throw out everything. Okay? Throw out all the differentials. Don't just be like, let me just guess my life here right now and be like, yeah, maybe it's pericarditis. But yeah, just throw out everything. Just be like, of course, pericarditis is the first thing that I may be thinking, because the patient has told me that leaning forward makes it better. I would prescribe them NSAIDs, but just to be safe side, I would still keep the patient admitted and make sure that I do an ECG. I'll send a troponin level. Just, you know what, do you understand what I'm trying to say?
Yeah,
So you're basically
yeah.
covering your ass from all, covering yourself from all aspects.
Yeah.
But God forbid that happens, okay? You're going to know everything, but just in case. That's why I'm saying practice with each other. You guys will come up with different scenarios for each other. You know, it doesn't have to be precise, but you'll come up with this different types of scenarios, and you'll be like, okay, this is what I'm looking out for. This is what I'm looking out for, you know? So in the history taking, that helped us a lot.
Okay, thank you.
Yeah, and none of the actors are going to go off on one, by the way. None of them are going to start talking about irrelevant things. They have a script to follow as well, okay? There was one book that I did buy. I wouldn't recommend anyone buying. If any one of you guys do have it, maybe we can find a PDF of it. Let me just check what it was called. It was like some OSCE. Let me check. But basically it had scenarios. So we use those scenarios. One second. I'm sure one of you guys will have it. Please let us know if you do, because then what you can do is send pictures in the group, well, you won't send the whole page of pictures, but you'll just send this the scenario, and the person that's being the examinee won't look at their phone at that time, so everyone else will know, okay, this is what this station's about, if that makes sense. It was this book. I don't know if you guys have seen this.
Oh yeah, this is a must.
Yeah, has one of you guys got this? As long as one of you guys have got it.
Yeah,
Perfect.
I've got that one.
So
we've all got it.
we use scenarios from that, because we were running out of scenarios at one point. We were like, oh, okay, well, here's an elderly lady with chest pain or whatever, and we had a lot of fun times. So we had a good time. Yeah, I still remember one of the girls that I was studying with. She was the funniest. So anytime it was an old lady, sometimes we would get the history wrong. We'd be like, yeah, the pain's been happening for 5 weeks, and then she'd be like, well, bloody hell, what have you been waiting for this long? So we had a good time. We'd laugh through everything. But just make sure you put in the hours, okay? Please, any of you guys that are sitting there alone and studying this alone, I'd recommend you start to, you know, if you're a shy person and you don't want to be in the group, just pick one person and start studying with them. As long as you're getting a couple of hours done with someone, it's better than nothing.
Okay, thank you. And one more thing, please.
Yeah.
There's this NCA syllabus, right, document I have. I'm not exactly sure where I got it from. So I'll send it into the group, and maybe if there are some topics that you think are more likely to come out and they're not there already, please, if you can indicate as well.
Yeah, I will. But of course, make sure you're going to get 2 of the focused histories. So one medical, one psych. You're going to get a perioperative. You're going to get a teamwork and handover. A quick thing about teamwork and handover. There's going to be 2 scenarios. I'm sure Dr. Kerm's gone through this with you. There's going to be 2 scenarios. And with me, what happened is they just showed me a chest x-ray. And obviously the task was young man running around, came into A&E. Here's a chest x-ray. I was like, oh, okay. And then I looked at the chest x-ray. It was pneumothorax. Thank goodness. And then the other one was just... The other one was hyperthyroidism. So with the hyperthyroidism patient, they gave me blood results. They didn't say hyperthyroidism, this patient has hyperthyroidism. They gave me blood results, and you had to figure out it's hyperthyroidism. At the end, I basically called the registrar the registrar was an actor, and I not handed over, but discussed the case in an SBAR way to the patient, if I say patient once more, please kill me, someone. But I discussed the case in an SBAR manner to the registrar, and I asked if they could come and review the patient. And meanwhile, once they're on the way, if there's anything else that I can do in the meantime, and that was it. And I passed that as well. And then the additional question for that was, what would you prioritize? And that's most likely 99.99999% is that's what the question is going to be from the examiner. Which one would you prioritize and why? Okay,
Right.
and that's it.
Okay, thank you.
So that's going to be another one that comes up. Sorry, I was going through my list here. One definitely, prescribing station will definitely come up. So how many do we have? We have 2 focus history. We have 1 perioperative that please figure out. And if any one of you don't know, ask Rachel, because she's the master of knowing what the mesh and hernia repair is made out of. Perioperative, you've got teamwork that will definitely come up. You've got prescribing that will definitely come up. You'll have 1 clinical skills, 1 examination, definite. Okay, so we have 5, 6, 7. You'll have A to E, okay, definite, so it's 8. You have 9, another one definite is going to be BLS. Okay, so how many do we have for sure? Okay, so we have 5, 6, 9. 9 of these stations you already know. Okay, the other 3 is going to be repeat. So they're either going to be patient education or challenging communication. Out of the challenging communication, I've sent you what you those topics that I've covered in there is going to be one of those. Read through them casually. You know, you can put your own little spring to it however you want. It doesn't have to be. It's a very free flow conversation. And if it's patient education, make sure you're referring them to the appropriate management places that they need to go to. For example, if it's smoking cessation or alcohol dependency or weight loss even, you know, I remember weight loss has come up for someone before as well, and we're like, what? But I think Dr. Kerm does have him in his notes, although I used to laugh at him, like, why do you have this station? I don't think this ever come up, but it has come up. So yeah, just very easy stuff like that. One of those will be that, so that's 10, and you've got 2 more stations. I'm assuming 1 will be an ethical and legal issue when you have to assess the capacity of a patient, because the what do you call it, the relatives are being a bit funny about the situation, and you are going to talk to them about, well, you know, I've assessed the capacity of this patient, You're going to look if there's any next of kins or whatever. At the end of the day, you know, the decision is going to be a medical decision in the best interest of the patient. So you just have to make sure that you're talking to the patient's relatives in a calming manner. It's basically, in those stations are just trying to see if you're a human being with a heart. Okay, so those are easy stations. The other ones, like I've mentioned, will definitely come up. So focus on those, go through every single scenario that possibly can come up. And yeah,
Okay.
I think we've covered it. Discharge planning could come up. Yep.
I have about 3 questions.
Yeah, go.
I'll start with the simplest one. Is there a clock or a timer right in the room?
I wish I could answer this question for you, but I did not look. I didn't see any timer for sure. I'm sure there will be a clock, but I wasn't paying attention to it. I didn't see any physical timer that would be like ticking seconds, okay, that would let me know. But I'm pretty sure that there will be a clock.
Okay, thank you.
I can clarify that with some of my colleagues if they were paying attention more than me, and I can get back to you guys in the group. But yeah, next question.
Yeah, okay, so the second one is one we've actually always wondered about. So in counseling stations or patient education, do you sort of take like a quick, short history, background history, like PMAFTOSA, before you go into the counseling or education?
Yeah, you do. You do take a quick history. You firstly, basically, you have to ask them why they're here. Okay, are they aware of what's going on? You don't want to be breaking news to them in a counseling station. Oh yeah, mate, you've got MS, like, you got to make sure that they know what's going on, okay? And they will know. Let me just get my notes out at the same time, but they will know. But you do take a brief history about what's been going on with them, how are the symptoms now. I'm so sorry you've been diagnosed with this. Am I making sense?
Yeah, but I meant more like the background history. Like, do you have any other medical conditions? Do you smoke? Do you take alcohol?
So
Do you
with
have
MS, I would ask those questions because alcohol can precipitate it, right?
Mhm.
Like the attacks, right? So you'd ask those things. What I can do is I can send you notes on this of exactly what questions I've asked. Say with alcohol dependency, you would ask about the alcohol intake in a little bit more detail than you would in a focused history, right?
Yeah, right.
Yeah, so you will take a history to answer the question. You will take in history, but obviously you got to make sure that you're timing yourself. You've got say 7 minutes, but 6 minutes practice with that. If you can take the history within 2 minutes, because you've got quite a lot to explain to them what they need to do as well, right?
Yeah. I actually find the alcohol cessation station very difficult to get under time. Like having
I've got
history.
I've got good notes about that. I can send it to you. So with the history with alcohol, sorry, I won't be able to go into too much detail on this, but it's basically what they drink, amount they drink, how long they've been drinking to. You're going to ask them tolerance questions, withdrawal questions. You're going to ask them occupational questions about what they work as, or has it affected their work. You're going to ask about medical history as well there, because some alcohol dependent patients can affect their medicines as well. If they're taking their medications, if they're compliant with their medications, or if it's affecting them taking their medication, which in turn is making their medical health deteriorate as well. So there are a few questions that you need to ask in this, but if you have a flow to it, you'll remember. So what I can do is I can send you these notes, okay?
Okay, and just a
Can
follow-up
you
question.
just remember to put this in the group and just be like, Ajum, you promised me to send me the alcohol notes, so I'll send them to you, okay? Because I can't find paper all of a sudden, even though I have my notes, but I don't want to write on them. Good.
Okay, then
What?
follow-up to that is, since it's a counseling station, right? We tend to talk a bit slower. Were you slow were you talking slowly? No?
I was speaking like how I'm speaking with you guys, and this is how I am, and this is just the way I am. But of course, I've got feedback in real life as well. Andrew, calm down. But yeah, I just want to get stuff done. But my advice would be take a bit time, but then you don't have time. So screw them if they're telling you to calm down, because you've got a lot of questions to ask and you've got a lot of marks to attain. So my advice is, I know if you ask Karim this question, he'll be like, oh, just come naturally to you. You're gonna, but my advice is just to try and get those questions out there. Obviously don't be talking like you're on a high-speed train, but don't be, sometimes if the patient goes off topic a little bit, you're allowed to bring them back. Okay, you're allowed to say, okay, Mr. Smith, thank you for giving me that. I'm so sorry. I'm going to have to interrupt you there because there's a few very important questions that I have to ask you. I know that seems a bit, and you're like, okay, well, it's my way or the highway. But listen, you gotta do what you gotta do in this exam, right? But that's just me being me and my personality telling you that. But I was quite fast and everything. So like I said in my feedback, it even said, please slow down.
Okay.
Otherwise, great job.
Then
but yeah, they actually made sure that they made the feedback for telling me to slow down. So of course it is something that I should probably relay to you guys as well.
I mean, as long as you pass the exam, I don't really
Yeah, exactly. I passed all the stations, so I'm not really complaining, but it's just like, it's just sometimes it's people's nature. And I'm sure there's some of you guys that are extremely laid back and extremely calm, but will still manage to get all the questions that I'm, trying to gasp out of my mouth. So everyone's different. But that being said, don't have too much of a relaxed approach, because time is very important here, you know? Yeah.
And then in terms of the psychiatric history taking,
Yeah.
Are we required to do the mental state examination? You know, not the mini one, but like check their cognition. Do you know where you are?
The
Blah, blah,
MSc,
blah.
yeah. You will, but it's just a couple of questions, by the way. You don't have to go whoop through the whole thing. I can send you notes on that too. That will help you. Just basically cognition. Your risk assessment is very important, that you have to make sure you get right. Your suicide risk assessment and your risk assessment in general are the questions, and these can all be covered in a couple of questions. You don't have to be like, oh, so what's the time and what year are we in and what's the president's name? No, you don't have to go through that. Okay, you just be like, Mr. Smith, do you know where you are right now? Yes, I'm in hospital. Do you know what time of day it is? It's morning-ish, I think. Okay, that's great. Do you know what year it is? Done.
Okay. And
Okay.
when do you recommend we do that, in the beginning or sort of like throughout the conversation, the mental state examination,
So
I mean?
Psych, it's quite hard because it's like a bit of a flowy type. See, that's something that someone like me that is very like checkpoint, answer me and don't talk about yourself, is very hard. But with psych, me being on there for 4 months has kind of made me realize that you have to, it's a flow. Okay, so you may study at home in a way like, okay, well, this is going to be my next question, this is going to be my next question, but sometimes it'll be like and you're going all over the place, but your questions need to be asked, but they need to flow with the patient's flow. Okay, so you need to flow with their flow, kind of thing. So your questions may not be in the order that you've learned, but your questions need to be asked, if that makes sense.
Okay.
So for you to ask them about their cognition earlier on is not a crime. Okay, it depends how the patient is. If the patient's coming in very confused and like, you're not going to sit there and be like, well, sir, please tell me why you've come in, you know, and it's going to be like, you know, they're a little bit out of it at that moment. So you're going to be like, sir, do you know where you are? You know, so it doesn't matter about you testing the cognition later or earlier. It's more you going with the flow with how the patient is. Does that make sense?
Thank you. That was really helpful.
No worries. Of course, if there's any other questions, I'm here for another 10 minutes until I have to rush off to a class. I'm so sorry. I don't want to spend all day with you guys. Of course, you have to study as well. But if there are any questions that you feel like, oh, no, I didn't remember to ask Anjum, just pop it in the chat. And if you feel shy or whatever, you can just directly message me as well. No problem. Okay, but I prefer if all of you guys do message it in the chat, because only saying this is so others can benefit from it too as well, because sometimes we don't think of the questions and someone else does, and we can all benefit from it. Any other questions?
Yeah.
Yep.
One other question. So I heard that you have like a couple of seconds after you enter the room to sort of confirm your identity with the examiner, right? How long does that take? Like, should we factor that into our timing?
That's going to take a second. So you basically put your passport on the table and you can start with your task. Of course, if you are not the person in your passport, they will be like stopping you from carrying on with the station. But that's it. They're not going to be like, okay, well, please sit down whilst I check which countries you have visited in the past 10 months or whatever. It's just literally a second. You give them the thing and you just start. That's what I did anyway. Maybe it'll be nicer if you can just ask, okay, is it okay for me to start?
Thank you.
Yeah, no worries. Anything else, guys? Okay, well, that's been great. I look forward to seeing you guys in some of the mocks. If I am grouped with you in a mock, please don't be strict with you guys. Actually very kind and nice. But I'm only going to be like that for the mocks, and I'll be jokey with you guys afterwards, but that's only for your own benefit, okay? So don't hate me too much. But I hope to see you guys. Of course, if there's any questions, pop them in the chat, okay, or directly message me. I honestly don't mind. Don't worry about the timings. If it does take me a couple of hours, I'll always get back to you guys. Please take into consideration when I said study with each other, okay, please, because it's very important. You have to get in the flow of the exam. Some things need to come as second nature to you guys. Okay, if there's anything else that I remember, I will always pop it in the chat. I'm so sorry that I wasn't present during the course itself. Normally I always am, but work has been crazy. You guys will start and you guys will know as well. And I am very excited for you guys. And I'll be keeping you guys in my prayers and you'll all pass.
Thank you so
I
much.
will. No worries, guys.
Thank you.
No worries.
Thank you
I'll
very
see
much.
you around. No worries,
Thank you.
guys. I hope I recorded this. Yes, I have. Okay. Bye, guys.
Bye.
Bye.